Hey, this is Shayna, your birth doula, childbirth educator, coming to you with a new video today. And I want to talk to you about fear and its impact on pregnancy and labor. So come on in, come on in. I'm so glad you decided to come back. And this is a very important topic that I think every mother goes through, whether you are a beginner mom, this is your third or fourth pregnancy. We all have some type of fear that sometimes comes in. And I just want to talk about the effects of pregnancy or what we can do to get over that hump of fear. So without further ado, if you are new to this channel, go ahead and subscribe for further content. Click that notification button in the corner so that you can get notified anytime I upload a video. Alright, so let's get into it. So, fear. Everybody has been in some type of situation that we have feared the consequences or just fear the unknown. And with pregnancy, especially for a lot of new moms, the unknown is the fear. Oh my gosh, I'm having a baby, I don't know how this feels, or if you are a mom that's already had a baby, this is your second go round, and you know you may have had a very traumatizing first pregnancy and experience with labor, and you just fear this outcome, or just in general you're just fearing, you know, some things that could possibly go wrong or not go right with the pregnancy. I'm here to tell you that that's absolutely normal. There's nothing wrong with you. First of all, when we are becoming pregnant, especially when we are first-time moms, our body is now getting a whole new redo. Your body gets a whole new makeup, and hormones that have never kicked in are starting to kick in now, and you got a whole bunch of emotions coming through and just flowing through your vessels. But the biggest one could be fear. And if it's not in the beginning, as you progress in your pregnancy, fear can sneak up. Some of the most common things that people fear when it comes to pregnancy is pain. How is it going to feel when it's time for me to have my baby? You know, will I be able to push her out, or is he going to be a big baby? Am I going to have a surgery? Those are some common things amongst other things that we fear. And the reason why I want to talk to you guys about the effect of fear and on your pregnancy is because it affects a lot. Let's talk about the hormones. There are a million hormones, and just a million is a figure of speech, but there are a lot of hormones that are new to your body, that's coming in and affect the emotions as well. So fear plays a big role in one of the hormones is adrenaline. When you're afraid, depending on what's giving you that fear or maybe making you afraid, your hormone adrenaline can kick in. Not only that, but your behaviors and everything that you're doing now affects baby. So your emotions, baby can feel. The things that we speak and say, the things that make us happy, sad, cry, all of that your baby is attached to. So your baby grows with the feeling of you being feared, happy, sad, or mad. So while it's normal and it's common to have fear, we don't want to let fear sit in. The duration of pregnancy, so from once you've conceived up into delivery, the negative effect that I want you guys to think about is the emotional effect and the bonding effect that you have with baby. Baby is connected, baby can hear the things, and when we fear, we don't always just think it. Sometimes what we think, we let come out of our mouths and things like that. So not only are we affecting our world on the outside with fear and the things that come with fear, but you gotta think about baby internally hears, sees, and feels all of those emotions. Secondly, labor. When you get into the state of labor, however you go in labor, whether it's at home or you make it to the hospital, you're fearing and your body can clench up. So during labor, when you're afraid and you are fighting against contractions or what you may think you can't tolerate, your body naturally will tense up. Well, if you think about it, you can only see the outside of your body when you're upset or when you're crying or when you are clenching and you're stressed in fear. But it's not just the outside that does that, your inside does that too. So as you go against what your body is naturally trying to do, you actually stop the progression of labor, and that is dangerous for not only you but the baby as well too. So everything, all the muscles, all the pelvis that's trying to open up and contract to open up, because that's what contractions are. It's getting your body, your womb, your pelvis and the canal ready for the baby to come out. So that's what the contractions do. You stop that progression and you actually make labor longer, worser, and harder for you and the baby. So what can we do to conquer those fears? So the good thing about pregnancy is before you get to labor, you got this 9 wonderful months that we go through of all types of body change and things like that. And then you have a provider. So you're either seeing a doctor at the hospital or maybe a midwife. Talk to whomever your caregiver is to overcome those fears. Write it down. What are you fearing? Is it the complications of having a baby? Talk to your provider about that. Are you afraid that you might not be able to push out the baby? Are there some health concerns of you that may affect the baby that you're worried about? Number one, if you're writing this down, put what are you fearing? Then 2, what can I do to get over this fear? What can I do, or who can help me? And then 3, take the advice of your caregiver or support team to be able to work over that fear. Another good thing to come that answers a lot of the questions too, besides your providers, is a Lamaze or childbirth class. Or you can speak to a nutritionist. You can speak to a birth doula if you have a birth doula. You want to speak to someone who's educated in the areas that you fear. No mom is perfect. No pregnancy is perfect. No pregnancy and labor and delivery is the same. Do not shame yourself if you know that your friends or someone else you know has had a smooth labor and delivery and pregnancy, but you may have had some hiccups in your pregnancy and your delivery is not as like theirs. Every mom is going to be different, but every mom is still a mom in her own right, however she delivers or whatever she went through with that pregnancy. But what we can do is conquer those fears. When adrenaline again kicks in, you tense up outside, inside, mentally. And it number one, hurts you and the baby. So there are books, there are YouTube channels, there are celebrities, there are people who vlog. I know that I found a lot of comfort in watching a lot of birth stories and, listening to other parents or other moms and their experiences, just to hear what they've done. But most importantly, I'm not afraid to ask a provider or someone when it comes to the educational points and what I need to do to conquer the fear. So what I want you guys to take from this video today is conquering your fear. You have to be able to conquer that fear, because once you conquer it, you'll be in the state of relaxation. You'll be in the state of knowing, and you're preparing yourself just in case something does happen, how to carry those things out, what you need to do. You can prepare your support team, which could be your doula, your spouse, your significant other, a parent, whomever is going to be around you to help you to get over that fear. Once you get over that fear, then you're going to put your body and your mind in a state of relaxation that's going to allow you to be able to enjoy your pregnancy, enjoy your baby, bond with your baby, deliver that baby however your situation demands you to be able to deliver it, and you'll have a wonderful experience. So, Thanks for coming on in, and comment below. Have you ever had a fear? What did you do to conquer it? Did this help if you are in a state of fear? And what videos would you like for me to do next? All right. I hope that you have a happy, healthy pregnancy, labor, and delivery. And until again, be safe. And the more you know, the more you glow. Bye.